Hello everybody, welcome to another video on this high yielding topics and MCQ discussion for the upcoming NEET PG examination. Now the topic we are discussing today is very important and high yielding for NEET PG as well as for INI-CET. So I will suggest you should not miss upon this topic. And also the table on Harrison has made this topic very easy. So let's move ahead to the question. Which of the following is not a feature of APS1? The options here are mucocutaneous candidiasis, onset in infancy, type 1 diabetes, and hyperparathyroidism. So to understand this and to answer this question, we need to learn a table. This table beautifully summarizes the APS1 and APS2. This is taken from Harrison. Now, first of all, the first point, the onset of the disease. In APS1, it is infancy, while in APS2, it occurs in later ages. Okay. Now, I want you to remember one more point about APS2, that APS2 is common in females. That is, females are affected more than males. Okay. While there is no such predilection of any sex distribution in APS1. So it is an important point because in future they can ask questions like APS1 is common in females or males. Okay, so we have to remember that there is no such sex predilection in APS1. Okay, now another most important point of this table is the involvement of AIRE gene. In APS1 there is mutation in AIRE gene that is located in chromosome 21, while APS2 is polygenic and there is association of HLA. Okay, this point is very important. Mark my word, this is very important point and you should never forget this. The next important point is presence of antibodies. There are no antibodies present in APS2 while antibodies are seen in APS1. Okay. The next point is asplenism. In APS1, we can see asplenism due to which they are prone for mucocutaneous candidiasis, while there is no asplenism in APS2 and there is no features of any immunodeficiency. Okay. Now moving ahead to one more table which is also important in regards to this topic, and that is the features of this APS1 versus APS2. The endocrine features includes Addison's disease, hypoparathyroidism, hypogonadism, Graves' disease or autoimmune thyroiditis, and type 1 diabetes. While in APS2 there is again Addison's disease, type 1 diabetes, Graves' disease, and hypogonadism, but there is no hypoparathyroidism seen in APS2. So this is one point regarding hypoparathyroidism, that in APS2 there is no hypoparathyroidism, and another thing is hyper versus hypo. So in APS1 there is hypoparathyroidism, not hyperparathyroidism. Okay, you can also remember these points. We have also already discussed them in the above table. Okay, so one last point I want you to remember is presence of myasthenia gravis and IgA deficiency, Parkinson's disease, okay, and celiac disease. These 4 points are important for APS2. Okay, so this summarizes this topic. I think this is a very high yielding topic, and one question is definitely going to come from this topic, and you should pack this topic. Okay, so coming to our question. So which of the following is not a feature of APS1? So we have already discussed there is presence of mucocutaneous candidiasis in APS1. The onset is infancy, while in APS2 it is later onset. Type 1 diabetes is seen in both, but hypoparathyroidism is seen in APS1, while in APS2 there is no such problem of parathyroidism. Okay, so D will be the answer here because in APS1 hypoparathyroidism is seen. Okay, thank you so much.